welcome to Athens Kaleidoscope. This is a new era for Kaleidoscope because those of you who are our faithful viewers know that Nan Michael has declared that she's retiring. Now, and she's not here today, so at least she's retired for one session of Kaleidoscope. We'll see. So I'm Jane Penwell, and I'm here by myself in terms of hosting the program, but I do have guests. And I'd like to introduce you to the guests that are sitting here with me. First of all, I'd like to introduce Laura Rush and explain a little bit about why Laura is here and these other two lovely ladies. We are going to talk today about something that is a resource of Ohio University, therefore available in Athens, Ohio. And to me, very interesting. I'm kind of a science geek and I love all this stuff. So we're going to try to explain in, I guess, layman's terms, what this particular institute that's a part of Ohio University does, why it exists, and what it offers to the community. So, with no further ado, let me introduce Laura Rush, who is the director, is that your correct title? Executive Director
of the Clinical and Translational Research Unit at the Heritage College of Osteopathic Medicine at Ohio University. Wow. That's a mouthful.
Yes.
So thank you very much, Jane, for having us on the show.
Oh, you're welcome. I'm thrilled. I plan to learn a lot, I want you to know.
Great.
So Laura has come to Athens and to Ohio University from a very varied background, kind of similar to myself. I have done lots of things before. I wasn't born saying, I want to be blah, 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 whatever. No, I've done lots of different things myself and had lots of different jobs and changed careers several different times. And I always think that's interesting, how does that happen? I'll tell you my story someday. But today we're going to talk about Laura. So when you were a little girl, what did you say? I want to be the director of the...
Yeah, not hardly. When I was little, I wanted to be a veterinarian.
Ah, my granddaughter wants to be a veterinarian too.
Yeah, I grew up on a big farm in Morgan County, actually, and I think every kid that grows up on a farm wants to be a vet. Mm-hmm. So I was right there.
Either that or get the heck away from that farm, one of the two. So you were interested in all animals, big animals?
I was interested in all kinds of animals. We had all kinds on the farm, and just interested in what makes them work, what makes them do what they do, how they get sick, how we cure them.
I think that's pretty interesting myself. Mm-hmm. I grew up in a farming area, and my best friend's parents had a dairy farm. So I was fascinated by cows. I really was.
Yeah.
Those big animals, and yet the end product is a bottle of milk. It's like, how's that happen?
Yeah.
Where did that all come from?
Dairy cows are amazing.
Mm-hmm. They really are. They eat grass and give us milk. Hey, what more could you ask for?
That's great.
So you went to veterinarian school.
I did. And before I did that, I was a registered nurse. I worked on the oncology floor of a large hospital for a long time, taking care of cancer patients, and then decided at some point in my career to follow my lifelong dream and become a veterinarian.
Fantastic. I love this. I love when people change horses in midstream. That's the best because you really want to do it or you wouldn't up and change everything in your life. So that was something you were really passionate about.
That's right.
So you became a veterinarian.
I did, and I specialized in pathology, which is looking at how diseases happen. So if you had a pet cat or dog, or if your horse had a tumor, the veterinarian would take a biopsy of it, and then I would read that under the microscope and try to figure out what's going on, what's causing the tumor. Or if your animal died, I would do an autopsy to figure out how it died.
Interesting. So did you have some kind of a purpose? In other words, were you able to create maybe some kinds of cures or come up with some kinds of things that could be done for the animal as a result of this?
Yeah, sometimes you just want to give the owner an answer, why did something happen, and make sure that the rest of their animals aren't going to get whatever that was, if it's a contagious disease. And then my special interest was in cancer, so trying to figure out if an animal had cancer, maybe why it was occurring or what we could do to help other animals with what we could learn from that.
I find it fascinating that so many times animals have similar diseases to ourselves. Of course, we don't think of ourselves as animals, but we really are.
Yeah, we are.
You heard it here. Accept it. But I'm taking care of 2 dogs for a friend of mine who's at the beach. Anything fair about that? Sending me pictures of herself on the beach.
Oh,
too, I
wonderful.
might add.
Just rub it in.
Yes, exactly. And eating a crab, which is one of my favorite things. But anyway, this dog is sneezing and coughing. And she was diagnosed as having an allergy.
That's right. That's the first thing that came into my mind when you said that.
Go figure.
Yeah.
And I do too. So I said, well, I'll just give her a Benadryl, like I did myself. And her mother goes, no, no. But what is interesting to me about this is that does this cross over? In other words, if I had the flu, could this dog get the flu from me? Or vice versa, could I get it from the dog?
There are some diseases that go back and forth between humans and animals called zoonotic diseases. And actually one of the big new concepts in veterinary medicine and in human medicine right now is this One Health, and trying to realize and understand that anything that affects one species really has a far-reaching effect on many, many species. And if you look at some of the more recent epidemics like bird flu and swine flu, those can certainly carry over to humans, and humans can transmit those to animals.
It's really, I always know a little bit about what somebody said or some quote. I never know the real thing. And Nan used to get after me to look them up, and I never did. But somebody said, if a butterfly, flutters its wings in Indonesia, it can have an effect on us here in the United States. In other words, that we're so closely linked in many ways. So I think that it's interesting, fascinating, but we're not here to talk about that. So we will go on. Okay, so you were a veterinary, kind of a veterinary pathologist.
Yes,
okay.
I was.
And then what?
And then I did some further training in cancer research based on humans again, so trying to figure out what causes leukemia in humans. And that led me back to human medicine, and that was pretty interesting. So I've stayed on the human side for the past few years.
We're pretty complex, I think.
Yes.
So leukemia was a special interest of yours.
Yes.
One of my son's very best friends in high school got leukemia. Luckily, he survived, but it was a fight, that's for sure. That would be a wonderful disease to cure if we possibly could.
Yeah, we've made great strides in it, so I think the future looks pretty good for it.
Great. Okay, so then you got interested in humans, and now you're in the process of working in, pardon me, a facility here that's going to treat humans, right?
That's right. So the Clinical and Translational Research Unit, or we call it the CTRU for short, is a central facility for Ohio University, and we're based in the Heritage College of Osteopathic Medicine, and we're here to facilitate clinical research on humans. So if one of our investigators wants to do a clinical trial to test a drug or some sort of intervention or a medical device, they can do it with us, with the support of all of our staff, and we can help facilitate that and make sure they can get it done and get it done the way all the regulations say it should be done and get the best possible outcome for our participants.
Excellent. Well, I kind of got interested in this by being an experimental subject myself for a study that was done, 2 years ago, 3 years ago? 2 to 3.
About a year and a half to 2 years.
2 years ago. It was really interesting to me because it had to do with muscle weakness, and could that muscle weakness be improved and the muscle made stronger through a drug. And I thought that was wonderful because my mother had, I don't know how many, I'll say 5 strokes, and ended up in a nursing home and ended up in a wheelchair, even though there was nothing wrong with her spine or, anything like that, just because she was so weak. She couldn't walk due to weakness, not anything else. So, and she passed away eventually. She made it to 90, so, it was pretty good.
Yeah.
Pretty darn good. Her brain, however, well, we won't go into that, but she did have some mental problems as a result of all those strokes, but she was pretty peppy still. So I thought to myself, if I could do that and it would help somebody else, somebody else's mother or somebody else, or even me, when, God forbid, I get, weak, it would be a wonderful thing, because just to lay in a bed in a nursing home, I can't think of anything much worse. Although, they did get them up, like I say, and put them in wheelchairs, but it's not the same thing as having your own mobility, as you know.
It's not the same.
This is how I kind of found out about this, that, Ohio University is running these studies, and they're fascinating. This whole muscle thing was really interesting to me. Okay, now you're probably saying, who are these other people? How come they're here? Well, Lynn was the nurse who shot me in the stomach, mind you, with that muscle improvement drug.
Somebody had to do it.
It's a tough job, but somebody had to do it. I don't think I really knew. I mean, they probably said in the stomach, when they were talking, but blah, 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 blah. They talk, sorry, Laura, blah,
There's
blah,
lots
blah.
of information for informed consent.
And I'm not a patient person, I'm just like, get it over with. What do you want, So I didn't listen as carefully as I should have. It wouldn't have deterred me, though. I'm sure I would have done it anyway. When the reality became, fact in front of my eyes, and there was a needle and it was pointing at my stomach, I was like, what have I gotten myself into? So you want to be sure, if you ever do decide to volunteer, which I, of course, volunteered, that you really know what you're getting yourself in for. But the nice thing is, you can always say, I unvolunteer. No,
Absolutely.
Nobody will come to your house and drag you out and say, you have to have a shot in your stomach, whether you want one or not. Won't work that way. So, you're a nurse, Lynn.
I am.
But you sort of went around the mulberry bush, too.
Did I? Yeah. Never a straight path for me.
Well, tell us a little bit how, when you were a little girl.
Oh, I wanted to be an artist.
An
art
artist.
teacher, and but I was involved with art, in particular music, piano and violin, and started dance classes. And once I got to college, I thought I'd be a nurse, and I went through the first 2 years at the university, and I loved it. I loved science. I loved it. But I got into my first clinical. I was accepted into the clinical program and got into my first semester, and I didn't like it. And so I got into the second semester, and I had to give some pre-op injections to a patient, and I was so nervous, and I decided to get out of nursing. I thought, well, I can barely take care of myself. Other people.
Alone.
I really, what?
I got to ask you, do you listen to NPR?
I do.
Did you hear this doctor talking yesterday? He was being interviewed about a book that he wrote, and on his first day in the labs, he walked in and they were dissecting a rat, and he fainted. He fainted. A rat. I'd be like, who cares? Cut that thing up. I think, having never seen anyone dissect a rat. But so she said to him, the interviewer, what made you go on? And he said, I just was determined. It was what I wanted to do, and I was determined. And he had several other similar experiences and setbacks, but he just forced himself. How many people do you think have to do that? I mean, I always think if you're going to be a doctor, you probably have been born with some ability to just like accept that, but maybe not. How many people fainted in your class?
Oh, we had a few. And there's a saying, the bigger they are, the harder they fall.
Oh, I bet.
It's true.
Well, so you decided that wasn't for, unlike him, you decided that's not for me.
At that time, it wasn't for me, and I started immersing myself in voice lessons and dance lessons, and I started auditioning, and I actually got hired to perform, and but I did graduate with a degree in journalism, and but I started performing in theme parks, and
Oh, cool. I know several
through
people
my-
who've done that.
yeah, I had so much fun. It was a blast.
I bet.
I would link myself up though with PR departments, and I would do some writing for their employee newsletters and kind of keep my writing skills up. I ended up at Disney World supervising in the entertainment division there, running parades and shows and casting various things.
Oh,
and
I'm so jealous.
traveling
I would love
off
to do
property.
that.
Yeah, it was so much fun. It was so much fun.
I'm sure.
So I literally worked in the character department. So I would schedule Mickey and Minnie and Goofy and Pluto and travel with them to different parades and various things. So
I have Minnie Mouse tissues on my desk right now.
do you?
I do. I love Disney. So when you were doing all this, were you like involved with the creation of the costumes? Because I notice from time to time when I go, they change. They're not always the same.
No, that probably was wardrobe or higher up design people.
Higher up.
Yeah.
There's always somebody higher
Higher
up,
up,
isn't there? For sure. So your job was to promote Disney, go on the road, that kind of thing.
Well, there were lots of pieces. So they have character breakfasts in the morning.
Yes, I know
So
about
I would
that.
make sure that people were assigned. So Mickey, Minnie, Goofy, whoever would show up at the Continental Hotel for breakfast, or at the golf resort, or wherever. And then we had meet and greets on property at various locations around the Magic Kingdom and Epcot Center. So we made sure the various characters got out in their various locations. We had shows, so singing and dancing shows, and the characters were involved with those, and rehearsals. We had a parade every day at noon.
Right.
We always had a grand marshal, and it was usually a celebrity that was on property at the time. Michael Jackson, for one, was one of our more popular grand marshals.
And did you have to
And-
wrangle these celebrities?
there was a marketing department that oversaw the movement of different celebrities throughout the park. And so I just would meet people, meet them at a determined location, and then we would get them to our car in the parade and move
Cool.
them
What
through.
fun.
Yeah, it was so much fun in my 20s.
Oh my
I
gosh,
had a
I
blast.
can't imagine.
Yeah.
I can't imagine. Because in my checkered past, I was, for several movies, I wrangled extras.
You did? Oh.
One of the many things I've done. And it was fun. It was really fun to see how movies made and all that kind of stuff. But, oh God, the waiting.
Yes.
They have to move those cameras, and oh my God. And I'm not, as I said, I am not a patient person. Waiting is not my thing. So
yeah, I
it was
worked in
difficult.
Nashville at Opryland for 2 seasons, and the performers in the park got to be extras in different pilot series and things. And I know what you mean, the waiting. I'd be sitting on a bar stool, waiting,
Waiting, what's
For the
going to happen? Gosh. And that, that's just part of it. So
Yeah,
you got
so-
sick of that.
So I had a blast in entertainment, but I realized I was traveling a lot and I was working when everybody else was playing. And I also, I think supervising, there were about 250 people in our department, and I also worked with young people when they had different medical problems or other kinds of things, and I found I really enjoyed that, just sitting and talking and discussing issues. So I knew I'd kind of come to the end of my entertainment hobby and wanted to pursue something in healthcare. I moved to Madison, Wisconsin. I love Madison, and explored a variety of things.
If anybody out there in Athens land has ever been to Madison, you'll know it's a weird kind of similarity. I mean, it's a very similar college town. A little
Big
bit
Halloween.
bigger. Big Halloween. A little bit bigger, I would say.
Yeah, oh, definitely bigger.
Yes.
Definitely bigger.
But I can see how those two match up. So Madison, Wisconsin, back to winter.
Yes, yeah. I'm a northern girl. I'm a northern Midwestern girl, and I miss the change of seasons, the more dramatic change of seasons, and just the architecture of the buildings up north and
The leaves falling and all that stuff.
Yeah.
So when you went to Madison, were you then going for a healthcare degree?
I started studying French because I love the language, and I was kind of contemplating my next move, and I knew I wanted it to be in healthcare. So I looked into a variety of areas, and funny, I kept going back to nursing and reading the various catalogs, all the areas of nursing, obstetrics, pediatrics, adolescent, geriatrics, psychiatric. The list went on and on, community health nursing. There were so many options, and I decided that I wanted to be a nurse. But it scared me because I thought, eeks, I went the first time around.
It didn't work
scared
so well.
me, and I decided I applied to a variety of programs, and I explored and visited different universities, and I ended up going to Marquette University in Milwaukee. I loved their program. I think I had 9 different clinicals, and obstetrics was my favorite, and I knew I was going to be an OB nurse, and that's what I was. And once I got into OB, I ended up specializing as a neonatal nurse and attended deliveries and taking care of those little ones, and all the equipment was so little and cute.
And they were so little and cute.
And they were so little and cute. So
I think all of us look at babies' feet and hands and say, how's this possible? It's going to make a whole great big human being someday. It's
amazing, yeah.
It
It all
really
works
is.
out mostly.
It does. And so how'd you get to Athens?
How I got to Athens, I met my husband-to-be.
See, there's always a man.
Man
involved.
Oh, he's a philosopher, and we fell in love, got married, lived in Kansas City, Missouri for a couple of years. I worked as an OB nurse, and he taught. The job opportunity at Ohio University came up, and so we packed our bags and came here. My oldest was 2 weeks of age,
Oh, goodness.
which was a challenge.
To move with a 2-week-old.
And I stayed home 11 years. I have 3 kids, and to get them all in school full time. And a physician friend of mine kept saying, Lynn, when are you going to get back into nursing? When are you going to get back into nursing? And I said, I want to get back into nursing, but I can't do it full time, and I don't want to work night shifts or holidays. Just with my young family, it'd be too much to manage. And anyway, I said, I've got the job for you, and
Here you are.
it was research, and I'd never even realized this was an area of nursing. So that's
that just goes to show you. I mean, if you stick around this world long enough, you're going to find a lot of stuff.
Right.
It's been true for me, too. So now,
yes.
we're going to talk to Leanne, and you and I may be related because my maiden name is Williams.
Oh, is it really?
It really is.
Wow.
Not that uncommon of a name, I know,
it's
but
pretty popular.
it really
There's a lot of
is.
Williams.
And I've been doing research on ancestry. And my Williams grandfather and grandmother came over here on a boat from Swansea, Wales. I mean, they were the real deal Welsh,
Ah.
Yes.
you
yes.
know, so.
As is my husband's lineage from the same area.
Oh my
so,
gosh.
yeah.
So maybe we really are related.
That could be.
It's really interesting because there are so many people with the same name in Wales. It's really difficult to do the genealogy, you know, to do the research because Thomas Williams, there's hundreds of them. So it's been a challenge, but I like a challenge. So tell us your story when you were a little girl.
Oh, when I was a little girl, I wanted to be everything. Ultimately, I wanted to be a mom. I think that was, you know, every little girl playing with babies, and I think that that's what it, you know, it didn't really strike me till I got in college that I hit my first psychology course, and I fell in love with just human behavior and counseling. So I thought that I was going to be a child psychologist until I got to my undergraduate, my senior year, and I did my capstone, and it was a research project. And it was, we ended up doing an addiction research project just to kind of check out what alcohol did with college students. I think we kind of all know what
That's
happens.
a big topic.
But I fell in love with research then, and I didn't realize it at the time, but it kind of set the path for, you know, kind of where I am now. I veered off the path, like Lynn, you know, the path's never
We
quite
all
straight.
veered off our paths.
So that's kind of where I got started. From college, I didn't know much about clinical trials or anything like that. I just knew I had a passion for research. So I worked on a demonstration project for Medicare and the elderly, and kind of some of the devices and things that help them stay at home a little longer instead of being in a nursing home or an assisted living facility. But that was a short-lived project, and after that, I decided to make a move, had no idea. Mid-20s, you kind of don't know, I think, at that point.
I think you're right.
You know, there's this quarter-life crisis, like, who am I, what am I doing, am I really doing what I should be doing? And I went toward, like, a sales home improvement route, a DIY type position, and it moved me around a little bit, completely opposite of the research and psychology aspect that I thought that I was going to go into. But at that point, I met my husband.
I knew it.
Yes.
That's what I was going to say.
Yes, I met my husband, and we have 3 children. But
So you got to be a mom.
I got to be a mom.
Accomplished that.
I accomplished that, but there was still, still that kind of desire in me for research, and so I started working on clinical trials with those with substance abuse. And so I was in addiction medicine trials for quite a long time, about 6 years until I came here. So that kind of led me to...
And now you are, you said, I think, that you were a nurse in the research area, research trials and so forth. We know Laura's the director, and you are...
I am a senior clinical project manager.
Wow.
Yeah.
Sounds like a very important person.
I think that it's just one of those all-inclusive jobs that need the support of everyone else, but we kind of help facilitate the project. So, you know, you're a research participant. There's a lot that goes on behind the scenes that gets to that point, even before you start
I'm sure.
asking for volunteers. You know, you're doing a lot of things.
And the trial that I was in as a volunteer, I had to stick around for, I don't remember, was it 45 minutes or an hour or something after I got that shot. And that was the worst part because they had this little room. And there was a TV, but it only got WOUB. Not that I don't like WOUB, but you know, Dora the Explorer, whatever was on at 10 o'clock in the morning, didn't appeal to me. So, you know, you don't think about that. I mean, I'm sure most people are so immersed in all those details of, you know, the really nitty-gritty stuff, and they don't think about the poor volunteer sitting in there. Eventually that changed, but it's funny how, I'm sure, how many things you have to all bring to the table to get this one study off the ground. And that one that we did was the muscle weakness shot was really complex too, super
Yeah,
complex.
A lot of moving parts.
Wow.
Leanne, we had an open house in the spring, and we'll have another one this coming spring that all your viewers can come and see our facility. But she made this display, which I think demonstrates what you're saying, all the details. So it was an iceberg, and you've got the tip of the iceberg, and that's your research results and your publication that comes out of that, and everyone's very happy about that. And then underneath that was all this massive amount of work and paperwork and the details that go into making one of these studies that you never see because it's all below the surface, but it's just critical that that all goes well, and that people are taking care of all those different things that go into it. And that's what Leanne and Lynn do so well, is do all those things that sometimes it's all invisible and nobody sees it.
Yeah, and I think we should say that if a company is sponsoring, sponsoring this trial of something, then they have protocols. You have to do it a certain way, and if you don't, so and nobody wants. So I'm sure that that's a big part of your.
That's exactly it. It's such a huge part. I think my role is just to make sure that there's collaboration between, these companies, maybe pharmaceutical companies, or the investigator. They have a protocol. They have a certain way they want it done. So kind of my role is, how do we get that going? How do we get it started? How do we do all of those things? How do we get all the staff available, all the stars to align, and they don't always align.
I'm sure.
But to actually, make that participant visit a success, and then continued success throughout, having every visit done, troubleshooting anything that may pop up, and then getting all the data at the end. So it's just a continuous cycle of just, budget and staff and participant safety and logistics and, to get that medication, those results and that paper or, that approval.
And having just been a tiny little part of this, I can well imagine. And, this takes place in a building on Ohio University's campus and not in some a hospital or anything like that. So it's not a clinical setting, hardly. I mean, a little bit clinical, but not too much. And it's kind of quiet, and you really don't realize how what all this stuff was going on before you got there. I found out more and more as how long was, I think it was a year, wasn't it? I think we were in that study for a year, not continuously, but every month or every couple months towards the end. So, but I really got to see what it takes, and I'm kind of one of those people that likes to get everything together. I kind of like make something happen. I like that idea. So it must be rewarding when you see it happen and it works.
Absolutely. When a study ends and it's done and you look back on it and you're like, oh my gosh, that was,
I bet. I just can't believe it. It happened.
Yeah.
That's like giving a party. I get these great ideas. I'm going to give a party. Then I'm like, did I invite those people? Oh my God. Now I have to clean the house and sip out the kitty litter and, whatever. I'll fix the food. But in the end, it's always fun. And that's kind of what you're doing. You're giving a little party and you're inviting people to come and help you to do something. And the more fun now, and if anybody's thinking about this, that might be fun to do. See what fun people these are? I mean, come on. You just never have a bad time. And this is these guys are the tip of the iceberg. There's a lot more fun people too. I never met anybody on the entire staff that I thought was grumpy even. Never mind not nice, just even grumpy. It was a good thing because it was a little bit frightening at first. And had anybody been grumpy or whatever, I'm one of these people though. If I say I'm going to do something, I'm probably going to do it unless there's some really good reason. But nothing dissuaded me. I was happy to keep going. So that's important too, that everybody who works there has a nice attitude and seems to enjoy what they're, like these guys, they said, she said she got pulled back in research, and Lynn said, I didn't know there was such a thing as a research nurse, but hey, have at it. Yeah. And you see, Laura, you've kind of been a science geek all your life, I think.
Yes, I have.
And so this has to be fun for you.
It's very fun. It's really, really exciting to think about the science and the new knowledge we're helping to create, and it's going to move healthcare forward, and that is really exciting to be a part of that.
Oh, yeah. And I felt that. I really did. I told you, I kind of did it because I saw what happened to my mother. And so then I thought, oh my gosh, this isn't a little thing. This is a big thing.
It's a big thing.
Yeah, if I can contribute even this little teensy weensy bit, it's a big thing. And I'm thrilled and happy that I did it. I have to say, I enjoyed it. It was interesting. And like I say, I'm a little bit of a science geek, so it really interested me how this whole process of improving muscle strength was supposed to work. We say how complex the body is, but it's really a chemistry factory in a way.
Well, that's a good way to put it.
Yeah.
And I can just say, I think I speak for all of us and all of the other staff that weren't able to come today, that we are so appreciative of volunteers like you who come and donate your time and volunteer to be in these studies, because without folks like you, things wouldn't move forward, and we're just so grateful. And we speak of you as being our medical heroes.
Oh, wow.
So.
See, I never knew that. To invite you guys back.
Yeah.
Well, in a way, there's a lot, I guess, in medicine, when you think about it, there's a lot of unsung heroes kind of like that, that were experimented on back in the dark ages when it wasn't any fun at all, probably. But they did it. I think of penicillin, like just randomly discovered.
Yes.
Without no plan involved. Now, look, they're trying to discover a new drug, and whether or not it works, totally planned. Every little morsel of what happens is planned. So it's fascinating, isn't it? From, what was his name, Fleming, who discovered penicillin when? Do you know, like ballpark?
I don't remember.
Back in the 1800s, I think, wasn't it? Or early 1900s?
Yeah, probably early 1900s. I'm not really sure.
You're probably right, because I think
it was after during the Tuskegee trials in Alabama, maybe when it became more available.
Because I know that I got penicillin as a child for an illness that I had, and my mother was scared to death. She's like, what is this stuff? What's it going to do to her? And my doctors, I grew up in a small town with small town doctors, Dr. Jim. And he's like, Faye, don't worry about it. It'll be fine. Nobody died from it yet. Ha, ha, ha. Well, then my dad gets sick and they give it to him, and he's allergic.
Oh, no.
Oh, he blew up like a balloon.
Wow.
Yeah. So these things are all controlled now. I think it would be very, very, very rare that anything could get on the market or even be used that would create an allergic reaction like that.
Well, they do their best to figure that all out before things go too far.
I'm so impressed because, if you take medication, and most of us do take something, you just pop it in your mouth and swallow it. You don't think a thing of it. I don't. And thanks to all these guys, and like she said, to the human volunteers, you're safe. You're pretty much safe. It's fascinating. And then you could talk about the pharmaceutical companies. I mean, once it's safe, then they have to figure out how to produce it, how to distribute it, how many doses a person can have, and all that kind of stuff. Fascinating. Yeah. It's a fascinating industry, if you ask me. And there again, it's chemistry.
It is chemistry.
You're trying to change a chemical reaction in your body. And that fascinates me. I was not a good chemistry student, I hate to say. Yet again, I don't have the patience for that stuff. All those little parentheses and everything.
That's taking me back a ways.
Yeah, me too. Strangely enough, I really liked physics. it made a lot of sense to me. Like an inclined plane. Well, of course something's going to roll down there. There's no, of course it is. So, that made more sense to me than chemistry did. But our world now is so based on chemistry. I mean, there's so many things that every once in a while I'm kind of sorry that I didn't pay more attention.
It's never too late.
Oh, God, I could take a chemistry class. I probably would do better now because I'm more settled down and willing to study than I was when I was in high school, I gotta say. But, so where do you see yourselves now? You've got the center and everything. Where do you see yourself going forward? What are you hoping to accomplish?
Well, we would like to be involved in more clinical trials, so we're getting more and more faculty members at OU that are doing clinical research. Now that we have our facility established, it's much easier for them to do that. And so we're going to be involved in more and more of these trials that will make great new advances in medicine. Hopefully, you mentioned that we're in a not a super clinical setting. I think in not the very near future, but somewhere along the road, we will have a new research building that will be more clinically oriented, where people can come and it'll seem more like a clinic, and people will be able to even spend the night if some of our studies need overnight stays, and we'll have more sophisticated equipment. But as long as our faculty want to do different clinical studies, we'll be able to help get those going.
That is absolutely fascinating, and I am sure with all of the work that's going on at Ohio University in many different areas, I don't think you'll be out of business anytime soon.
No, it just keeps getting bigger and bigger. So we're really excited to be a part of this.
And there's a good thing in this for the university as well.
Absolutely. It gives the university a lot more prestige, and they're actively hiring people who do clinical research because they know that that's part of the mission of any college of medicine and any university as a whole is to generate new knowledge, and that's what we want to be a part of.
Now, doesn't that sound great? Generate new knowledge. I like the sounds of that. And lest you think in the 1900s, some people thought, oh, this is it. There's nothing more for us to learn. Well, we know all about everything. No, we don't. Not by any means.
Got a long way to go.
And if we get everything here, there's always Mars. We're going to go to Mars. Trust me. Your great-grandchildren are going to Mars.
Yeah, you're probably right.
I'm sure of it. I mean, what is the logical progression for the human race? We're not going to stay here. We're an adventurous, courageous group of people that are always exploring. I just think off they're going to go. And it'll be, somebody will be on a little TV show saying, when I was a little girl.
I want to see that.
Yeah, me too. When I was probably, I don't know, maybe a senior in high school, I don't know when, we went to Mars. We went to the moon. Sorry, I'm just dreaming. We went to the moon. And I remember saying to my grandmother, oh boy, I hope I can go. And she's like, Jane Ann, don't even say that. Why would you want to do that? Blah, blah, blah. Promise me you won't. I can't do it. If I get the chance, I'm going. And that's just me with nothing. I mean, I have no knowledge. There's nothing I could do, hardly at all. But I just had that feeling of, how great it would be to explore and, like you say, add to human knowledge.
Yeah.
So for sure, it'll probably happen. But meanwhile, back here on Earth, it happens, Ohio. I think it's a noble mission, indeed, to help with this because if you can, in some way, help to move something forward, even just a little bit, you feel pretty good about it. I can speak, I did this. I subjected my body to this trial, and honest to goodness, I just felt so good about myself.
That's great.
Talk about the psychology of anything, how do you make yourself feel good? Most of us, and by us I mean women, have trouble thinking well of ourselves. A lot of women do. we're always, oh, I'm not tall enough, I'm not thin enough, all except for her. She's definitely thin enough. But I mean, this is just the female of the species. So here's something you can do. It doesn't matter anything about that. I never even put on one stitch of makeup when I went.
Yeah.
You probably had trouble recognizing me.
Not at all.
It's
Not at all.
horrible. But this is something, you don't have to get dressed up. You don't have to do any of that. You just
Yeah,
go
it's not
over
fancy.
there and let them do what they need to do. And in the end, I got a really nice letter, you know, from the drug company and all kinds of things. And it really does give you a good feeling about yourself that you actually did something that's meaningful.
And we have all kinds of different studies, so not every study involves getting a shot. Not every study involves a long length of time. Some you just come in one time for 45 minutes for that particular study, and then that's it, that you're done at that point. There's other things that involve all different kinds of interventions or things that we do, and of all varying levels of invasiveness or time spent on the part of the participant. So we have a wide variety of opportunities for anybody who wants to volunteer.
So maybe we can put up the information on your center as well as you, Laura. We're going to send you out into the world. And you can certainly email or call either one.
Email or call with any questions, and we'll answer your questions. If you want to see if you qualify for a study, we'll see what's available and talk to you about that. And we'd love to take any phone calls that come or emails.
Yeah, and if you just want information, if you're just curious, give Laura a call and talk to her.
Yep,
Because,
that'd be great.
yeah, there's all kinds of things. Oh, that made me think of something else. Do you guys take volunteers who don't do a study? In other words, like somebody who might, you know, help you with other things? Or do you ever use volunteers in your information, going out in the community or anything like that? Or I can't think. If you want to put on a presentation to help you with that sort of thing?
Yeah, we have students who volunteer with us, but if there are people in the community that want to volunteer too, I'm sure we could find some way to manage that. We don't want to turn anybody away.
The last one I went to, the cookies were pretty good.
That's an added bonus.
An added bonus. That's right. Munch up a few cookies, or even make a few if you feel like that.
That's even better.
Yeah, honestly. I don't know when's the last time I ever made a cookie, but I could. I could do it. So, you know, all in all, I feel so proud of this because it is a part of our university and it is a part of Athens. And inevitably, when you go to Kroger someday, you're going to see one of us. So don't hesitate to stop us there either.
Right,
And say, did
absolutely.
I see you on TV? And
Yes,
what was that thing you're doing? And, you know, what's that all about? Because I know most people in Athens also are very proud of Ohio University and very happy to be living in a town where the university is and understand that it gets its prominence from some of these things,
Yes.
not just from football and Halloween, and although those are important, don't get me wrong. I graduated from Ohio State, so yeah, football,
yeah.
it has its place, definitely. And did you go to University of Wisconsin?
I did some studying there, and I went to the University of Wisconsin-Oshkosh. And I got my journalism degree.
Well, those Badgers have been
The Badgers.
nipping
Yeah.
at our behind.
Look
Ohio
out.
State. Yes, for
Look out.
many years there's been a little rivalry there. So, and the Badger itself is such an animal. Gee, the crickets, they can't even bring it to a football game.
Not a very good mascot.
No, definitely. Okay, so that is going to conclude our discussion with these ladies today. And again, if you have any questions, you're interested, you'd like more information, feel free to call or contact them. If you, like I said, if you see any of us in Kroger, stop us. People stop me in Kroger and say, I recognize your voice. I'm like, really? Wonder why. Do you watch TV?
Well, thank you for the opportunity to come here and talk about what we do. This is great.
It was lots of fun for
great
me
time.
too. And my goal is always in talking to anybody to learn something. And I certainly did learn something today. And that's always a good thing. So I hope, you'll come back. Maybe there'll be something new happen and we can reconvene.
That would be super.
Awesome.
Appreciate it.
So until then, we have to say a fond farewell to the 3 L's here. So maybe more on this later. We'll see what happens. Well, Athens, I hope you enjoyed that interview because I sure did. Those were some interesting ladies, and they really made you think about how you got to where you are. Very few people that I know, although I do know a couple, who said as little kids, I'm going to be X. And they ended up being X and were X all their lives. Very unusual anymore. I think people did that years ago. My father worked one job for 43 years. Went to the same place at the same time every day for 43 years. And that's so unusual anymore. I think it's more the norm. Those ladies and I have been in many, many different jobs and finally ended up doing something that we would have never imagined we were going to do when we were 20 or 30 even. So I hope you enjoyed that, and the information on the center is interesting too, and what they're doing at Ohio University. And I'm going to try to bring you some more people from Ohio University that are doing interesting things, because there's tons of them. I'm amazed at how every time I look at a person's bio who teaches at Ohio University or works in some capacity, I'm always amazed at how much knowledge there is and how much work went into getting where they are. So I'm going to try and track down a few more interesting OU people and drag them on here if I possibly can. So you notice that there's no co-host. I said I was going to have a variety of co-hosts. Well, next week, probably, we will have a co-host, and it will be an entirely different kind of show, more like the old Kaleidoscope maybe. But, from time to time, I'm going to be doing these interviews. So I hope you like them, and I hope you find these people interesting. And should you have any ideas about who I should interview, or you want to volunteer yourself to be interviewed, it's fine. All you have to do is contact the station. We're in the, you don't even have to go to a phone book. You can Google Access TV Athens, Ohio, or ACTV Athens, Ohio. Bingo! You get the web page. All the information is there. I'm never able to remember anything. I can remember Access. I don't know why, but for some reason. So if that's what you remember, fine. Just Google it. Be sure you put Athens, Ohio, because there's other accesses around. But anyhow, we would appreciate your feedback if you have any. If you don't, continue to stay with us and tune us in and see what interesting stuff is going to be on tap. Next week, as I said, we're going to have a co-host. I'm tapping friends of mine to be co-hosts, so you'll see. We'll see how it works out. But anyhow, I have quite a bit of interesting footage of this African lady who was here at OU and who played a very interesting instrument, which at the moment I can't remember the name of, but it's kind of like a little teeny tiny piano. It sounds like steel drums, though. It's really interesting, and they play it inside a gourd. So we'll certainly have that next week for you, and maybe some other interesting stuff. Maybe I can steal some footage from Nan if she's still taping away, because that's what she likes to do. We'll see. But it's always going to be something interesting, I hope. So, Athens, until I see you again next week, hope you enjoy your week and take a little time to think about interesting stuff and let me know. Bye.